Good morning. So yesterday we talked about mental social health, or at least we left off on that. Today we are going to be covering the remaining careers. There's obviously more careers in the medical field than the ones that I'm going to mention in this presentation, but just keep in mind these are a good majority of them. And like I said, you guys will have an upcoming project where you'll get to actually explore one of these careers. So maybe start thinking about something that you're actually interested in. And then same thing as always, just make sure that you are also taking notes. You are submitting them to Classroom before the end of the period, and then letting me know too if you have any issues. All right, so I'm going to talk about mortuary careers, which if you don't know what mortuary is pertaining to, it is talking about preparation of the body after someone dies. So yes, this is kind of morbid, maybe to be talking about early in the morning, but this also is a career in the medical field that maybe not everybody thinks of when we are talking about medicine. So yes, somebody who plans on working in the mortuary field, oftentimes they are called morticians. And so the purpose of this job is basically to just, again, prepare the body so that it is prepared either for cremation or maybe their burial service. And then also making sure that they're honoring the person that is deceased. And depending on what type of culture that they are coming from, they are also honoring, their religious practices, their cultural beliefs, and so forth. So again, this is a career in the medical field we don't necessarily think of when we talk about medicine, but it is also something that people can do if they are interested in. Kind of going off of that, you also have forensic careers. So this is something that I personally have an interest in just because I enjoy true crime. I'm not sure if anyone else does, but your forensic careers are basically responsible for determining the cause of death of people who have either been involved in a crime or it could just be in general their cause of death. So one of the most common careers in forensics is going to be your medical examiner. So these are actual medical doctors. Oftentimes you might hear that they're called a coroner. Sometimes they're also called a forensic pathologist. Those are all terms used interchangeably. They're the same thing. Someone who is a medical examiner, coroner, forensic pathologist, their job is to determine the cause of death. So they are the ones that are performing autopsies on people who are deceased. Not everybody who dies obviously needs an autopsy, but if they are maybe involved in a crime, maybe their death was suspicious, maybe their death was sudden and they had no idea as to what maybe caused this person to die, they are going to be the person that's performing, again, that autopsy. And again, just keep in mind, they are a doctor. You can also have someone, though, who is a forensic scientist. So a forensic scientist, yes, we don't think so much of as a healthcare worker, but they are involved in healthcare. And so their job is essentially to deal with people who have died in a criminal manner. So they go to the scene, they collect any evidence, they then analyze that evidence, document that evidence, and then they would then send that to the medical examiner if the person who is deceased potentially has, been murdered or something along those lines. And then that way they can also help to determine the cause of death. So those are two positions that you not necessarily might think of when it comes to the medical field, but I do know a lot of people who have had students in the past do have an interest in this. So this would be something, if you're interested in true crime, maybe you want to research it. Nursing careers. So this, after reading through a lot of students' opening activity responses, this is probably the career that I would say the majority of students are interested in. And that's because nursing is highly respectable. It is a profession where you can have your bachelor's degree and make a really decent living. Nurses can also then get their master's degree or even their PhD and become nurse practitioners. So it is a career that you have a lot of opportunity for growth. And then also it's just a really well-paying job. Again, with the pandemic, you can see how respected nurses are now. I think in the past you should have already known that, but a lot of people just aren't aware of all that they do, all that they provide for people. But they're working directly under a physician. So again, they are not allowed to prescribe medication. They cannot diagnose conditions. They are waiting for their physician to give them orders, and then they're working underneath them. And they also provide so much more than just physical care. I don't know if any of you have ever been in a hospital setting before, maybe for a family member, maybe for yourself, but they also provide a lot of emotional and mental support. I have so much respect for people who are nurses. I think I've mentioned that my brother himself is an ICU nurse, and they just do so much more than just providing the physical care. They also do a lot of the emotional. They listen to you, at least they should if they're a well trained nurse. And yeah, they just do a lot of the work. You're typically going to be interacting with a nurse more than a doctor if you ever have to go to the hospital or even a healthcare facility. So you have different levels of nursing. You have a nurse assistant, which would be the lowest level of nursing. I've mentioned that ROP actually offers a certified nurse assistant program. So if you end up taking medical careers, you still are interested in nursing, there is a after school class that basically you would take for 6 months. So it's 1 semester in length. And then you sit through your boards exam, which again is just how you're getting that certification. If you pass it, then you have that CNA license. CNAs, again, just keep in mind, are the lowest level of nursing, but I would say if you really genuinely have an interest in becoming a nurse in the future, like a registered nurse, then taking that class probably would help you just so that you get a little bit of a background. And it's going to give you more experience than those who haven't. You can also have what is called a home healthcare assistant. So this person isn't technically like a nurse. They do have to obviously take courses to become one of these types of positions. But a lot of what they do is more so just making sure that, let's say somebody is put on hospice. Hospice is where people are placed if they are terminally ill. A lot of people choose to have a hospice in their house. So a home healthcare assistant would then come to the patient's home. They might help them with, hygiene issues. So giving them a bath or shower, feeding them, anything that might be needed in a home setting. You have your patient care tech. And so this person's kind of more of like not a receptionist, but they're an assistant. They're there to help the nurses in general. You have your LVNs, which is just a step above nursing assistant. So this is also a program where you have to become licensed. So you have to take a boards exam. The level of education is a little bit longer than your CNA program, but just know that they are a level below your RN. So again, still a job where you can make a decent amount of money, but your registered nurse is going to be making more than that. So your registered nurse, again, you can do it with a associate's degree, so a 2-year program, or if you think of probably the majority of nursing, it's going to be a bachelor's program, so 4 years. And again, all of these are great positions. Your RN, though, is going to be the one where you're making more money than the ones below it or above it. There are also jobs, obviously, in nutrition and dietary services. And I'm sure you guys are familiar with that, but just someone who works in nutrition dietary are just trying to focus on the importance of good nutrition. It's not just so much, I'm going to treat someone who's, let's say, morbidly obese. It could be that maybe somebody has type 2 diabetes, which is often due to improper nutrition. So they might be going through and teaching their patient with type 2 diabetes how to eat properly, how to maybe count their carbohydrates, maybe choosing different alternatives for foods that they enjoy that might be healthier. So yeah, the jobs in these, they're teaching proper nutrition. They're also dealing with patients who might have eating disorders, so anorexia, bulimia, making sure that they're aware of the psychological aspects behind those conditions, working with psychologists, psychiatrists to make sure that those people too have proper nutrition. So your examples, you have your dietitian or nutritionist. So I mention this to students every year. Anybody can call themselves a nutritionist. So a nutritionist is not a certified profession. There are courses you can take to become a nutritionist, but just know that anybody can call themselves a nutritionist. The level of education is lower than someone who is a registered dietitian. So a registered dietitian is someone who has gone to college, not saying that nutritionists haven't, but dietitians have gone to college for at least 4 years. They have then gotten into a dietetics program. They have sat for a boards exam, and then they have passed that. So just know both of these are dealing obviously with teaching people proper nutrition, but just know dietitian is going to be your more formal, more professional level of education. You can have a dietetic technician or a dietetic assistant. They are just working underneath the dietitian. If the dietitian is recommending to a patient, these are the things that you need to do, the dietetic technician might also be following up with those patients, and that sort of thing. Your dietetic assistant or food service worker. So if you think about, let's say, like meal prep companies, yes, those people who are working for meal prep companies are probably also culinary professionals, but they can also be considered someone who also is working in the medical field, and that's because they know proper nutrition guidelines, things like that, to provide food, healthy food for people who are using their meal prep service. You have your veterinary careers. So I've had a couple students confused as to whether veterinary careers were actually a part of the medical field. Yes, they are. So it's not obviously dealing with humans, but animals definitely need to receive care as well, and they obviously have medical conditions. So yes, this is definitely a medical career. But you can work with all types of animals. The majority of veterinarians actually choose what types of animals they're going to work with. So you have veterinarians that might be working with your house pets, and then you might have veterinarians that focus on working on large breed animals like cows, sheep, horses. So those would be more of your livestock. And then you have veterinarians that you might see at a zoo who are dealing with like wildlife. So again, there's different types of specialties that veterinarians can go into. It's very rare that you would find a veterinarian that covers all different animals, just because that would be way too much for them to specialize in. So again, veterinarian is a medical degree. They have to go to veterinarian school. Veterinarian school is usually 4 years on top of your bachelor's degree. And then they again have to also pass a boards exam. You can have your vet tech or veterinarian technologist. This is also a career where basically you sit through usually 1 to 2 years of a program, you take a boards exam, and then you're licensed as well. So just know the vet tech is a great starting point, but your veterinarians are going to be the ones that make more money. So I know several veterinary technologists, and a lot of them wanted to pursue veterinarian. It's just that this obviously takes a lot more schooling. They still want to work with animals, so they're kind of getting a little bit of both. And then you can have your veterinarian assistant. So this is somewhat like the caretakers for them. So they might not even have formal education. It could just be on the job training. But again, this is also a position in the medical field that you might not necessarily think is a medical position. You have your vision service careers. So I'm sure you guys are all well aware of what vision does. It's important for you to be able to see things. They are responsible for preventing further vision disorders and also caring for them. So for those of you who wear glasses or contacts, you technically have a vision disorder. It's not going to be obviously as extreme as someone who maybe has blindness, inability to see completely. It's just, in general, you have a vision disorder. So if you have ever gone to an eye specialist, you've either seen an MD or an OD. So your ophthalmologist, and this is kind of similar to like psychiatrists and psychologists, your ophthalmologist actually went to medical school. Your optometrist went to optometry school, which is still a lot of training, but it's not the same amount of training as someone who's an ophthalmologist. The ophthalmologists are typically going to be the people that are not giving you the prescriptions necessarily, but they're going to be the ones that are performing, let's say, LASIK eye surgery. If you have more severe vision disorders, they're going to be the ones that are treating that. Whereas your optometrist is probably, if you've ever had corrective lenses prescribed to you, they are going to be that person. So they're able to prescribe eyeglasses, but they can't necessarily prescribe you medication, if that makes any sense. These ones below are just different levels of assistants, techs, things like that. And so they just work underneath the optometrist or the ophthalmologist, and they are providing any assistive techniques that either of those two professions would need. Last thing we'll talk about are your diagnostic service careers. So these are careers, again, that you might not necessarily think of as medical professions, but they are jobs that are definitely needed in healthcare. The first one is going to be your cardiovascular technologist. So they are ones who are there to detect whether or not you might have any abnormalities in your heart. So they are the ones where you might be set up with, let's say, an ECG, which are the electrodes placed on your heart. They will be the ones who are just, I guess, detecting. They'll be running the tests for you, and then your doctor will then look at those test results and determine whether or not you have a heart condition. Kind of similar with the vascular technologist, they are going to be doing imaging on your blood vessels. So if you're someone who maybe has clogged arteries, issues with maybe the valves in your heart, they will be determining that through imaging and then performing that test on you. And then again, your doctor is going to interpret it. And that's very similar to your electrocardiograph technician. Again, they're going to be setting you up with electrodes, running that test to see your heart rhythm, and then sending that to your cardiologist, which is your heart doctor, and then they would be determining. So these are lower level positions. A lot of them are just running the actual testing, which is what diagnostic means, and then sending that info to your doctor, and then your doctor is then interpreting those results. Electroencephalographic technologist. So similar, cardio is pertaining to the heart, encephalo is pertaining to the brain. So they are putting electrodes on your head. It kind of looks like a mesh little net cap. And then same thing with the cardiograph. They're running testing on that, sending that to your neurologist, because the neurologist is the person that determines brain conditions and disorders, and seeing what those results mean. And then you have your medical laboratory tech. So this could be someone who is working in a scientific research center. Could be that maybe you have some type of infection. You might need to have a urinalysis, so you might need to use the restroom and urinate in a cup. They would be the person then that would be taking that urine sample and checking to see if you have any abnormalities in that. It could be the same with blood work as well. Your phlebotomist is going to be the person who is taking blood from you. So if you've ever had to donate blood, if you've ever had to just have your blood examined, oftentimes you'll have a phlebotomist who is the person that is taking the blood out of you, and then they would be sending that to your medical lab tech. The lab tech would then examine it, and then that would be sent to your physician. And then the last one, it's kind of cut off. Let me give you a moment while this is your radiologic technologist. So if you've ever had a fracture, if you've ever had any injury where you've needed an x-ray, they are the people that are performing the x-ray. So again, it's a diagnostic career. So they are getting that imaging done, running the testing for that x-ray, and then they are sending that information to your doctor, and then those results are determined by your doctor. So all of these are careers that are typically not super high paying. I mean, you can make a decent living off of them, but they're ones where it's typically a trade job. You're not needing to go to school for several years. It could be a couple months, maybe a year or two, and then you take an exam and then you pass it, and then you're now in this profession. So these are just, again, some examples of the different careers in medical field. There are definitely a bunch more. And then there's also different specialties within these careers. So just keep that in mind. Tomorrow I will be going over your project, so you'll be able to research one of these careers. So yeah, just make sure you finish your notes, turn them in by the end of the period, and I will see you tomorrow. Have a good day. Bye.